The following program is an original production of WYCC PBS Chicago.
Tonight, could your zip code cost you your life? A close look at trauma care in Chicago and trauma deserts, neighborhoods plagued by gun violence but least equipped to save the victims.
Jesse Jackson Jr. and his wife may be headed to prison, but for how long? Public pleas for leniency and harshness. Letters pour into the court that will decide their fates.
The battle over Chicago school closings ratchets up as the teachers union files 2 federal lawsuits. What this means ahead of next week's final vote on the plan.
And another court battle, this one between Donald Trump and an 87-year-old Chicago woman. And he's accusing her of playing the age card. These stories and more tonight on In the Loop.
Good evening, I'm Barbara Pinto.
And I'm Chris Bury. Tonight we take a closer look at the crisis facing trauma care in Chicago. The patients who need it most, including young victims of violence, have to travel the longest distances. And when it comes to getting trauma patients the care they need, every second counts.
But there are no adult trauma centers on the city's south side, places where gun violence and shooting deaths are most common. Tonight, we take you to Roseland. There is no such thing as a slow day here at Roseland Community Hospital on Chicago's far south side. This emergency room treats 28,000 people a year.
We see a lot of patients, asthma, seizures, hypertension patients, and diabetes, which runs rampant in this community.
So does poverty and gang violence. Dr. Larry Mitchell runs Roseland's emergency department, where treating gunshot victims has become routine.
So on any given night, we may see 1 or 2 or 3 gunshot wounds. Most of the time, there are non-life-threatening gunshot wounds, but occasionally we get some who are really, really shot up, and we need to try to stabilize them as much as we possibly can, then transfer to one of the trauma centers.
35 Roseland patients were rushed by ambulance to trauma centers last year, 29 already this year. But the closest Advocate Christ Medical Center in Oak Lawn is nearly 10 miles away. Time and distance that can mean life or death.
Patients are bleeding out. You got to move as fast as you possibly can, which is why it's an emergency situation in itself.
There are 11 Level 1 adult trauma centers in the Chicago area, most on the north side and in the suburbs. The University of Chicago Medical Center in Hyde Park closed its adult trauma center decades ago, and Michael Reese Hospital on the south side shut down in 2009. Roseland sits at the epicenter of a so-called healthcare desert, ironically where trauma care is needed most.
It says the community with the crime and the trauma don't have trauma centers, and the communities that don't have trauma centers.
Diane Powell is president and CEO of Roseland Community Hospital, where 40% of emergency room patients are uninsured, unable to pay for their care. As a result, Roseland is millions of dollars in debt, in danger of having to cut services to a population in dire need. And Roseland's problems echo those of hospitals nationwide. According to the American Hospital Association, emergency room visits soared by nearly 44% over the past 2 decades, while 11% of emergency rooms shut their doors. Over a similar period, 339 trauma centers closed. Their high-tech diagnostic equipment and surgeons on call round the clock are expensive, and many hospitals opted out.
Roseland serves a particular population that most cities and most for-profit hospitals do not want to serve.
It is very prestigious to have a hospital in your community. Did you know that?
Roseland administrators, community, and church leaders are pleading with Governor Quinn for $7 million to keep Roseland Community Hospital running.
We have reached out to our legislators to say, we need you to partner with us. We need your help.
Powell spoke at a church rally last week, the seats filled with former patients. 9th Ward Alderman Anthony Beal summed up the Roseland community's fight and frustration.
We're going to make sure we continue to fight to make sure that we have a trauma center on the south side.
Back at Roseland's emergency room, further proof of this community's need as doctors brace for the bad side of good spring weather.
Summertime, when it gets warm, we know at that moment in time there's potential of a gunshot victim being brought in to this emergency room.
A recent study to be published in next month's American Journal of Public Health sheds new light on who is most likely to survive a severe gunshot injury and why. Joining us tonight, the author of that study and Associate Professor of Surgery and Preventative Medicine at Northwestern Memorial Hospital, Dr. Marie Crandall. Welcome to you.
Thank you.
Now, you and your colleagues spent a long time, years, studying something that Chicago sadly has plenty of, gunshot cases, about 12,000 of them. In your research, what did you learn about who is and who is not likely to survive?
Well, we were interested in seeing if there were any things other than the things that we knew that contributed to the likelihood of dying. We know that age, the intent, so suicidal intent is more deadly, and the severity of the injury. Of course, if you are injured in your aorta, you're more likely to die than if you're injured in your foot. And we were interested in seeing if the trauma transport times, the transport time from the scene of an incident to a trauma center, made a difference for individuals injured by a gunshot wound. There'd been some previous research on the subject that had sort of fallen all over the map, but a large recent study showed that for a majority of bluntly injured patients, car crashes, falls, it didn't make a difference. But that was a bit counter to what I had experienced in Chicago and some of my colleagues, and that was the genesis of this study. So we actually used geolocation, geographic information software to be able to create distances between the scene and the nearest trauma center, found that there was an association with longer transport times, and that if you if you were injured more than 5 miles away from a trauma center, you had an increased likelihood of dying, even if you were injured with similar severity.
Now, break it down for us. How much more likely are you to die if you're injured more than 5 miles away from the nearest trauma center?
In our analysis, about 23%.
Wow, that's pretty significant.
It was, yes.
Now, which neighborhoods, which communities does this impact the most?
We created a map that sort of looks like a bunch of bubbles around the city of Chicago, and we found that most of the communities that were outside of this 5-mile window were on the south and the southeast side.
When you looked, I know you drilled down and kind of looked at a number of factors here. Did you factor in race? Did you factor in income, insurance? How did that pan out in your study?
We did. So we know that insurance, being uninsured and being African American, increase your likelihood of dying from a similar injury, gunshot wounds, blunt trauma. If you have the same mechanism of injury, having those characteristics make you more likely to die. So we found that just the gross mortality was higher if you lived outside of this 5-mile boundary. But in addition, if you controlled for age, race, intent, insurance status, all of those things, including injury severity, you were still more likely to die because you were further away.
Most of the people that did not survive in your study, I mean, were they African American? Were they insured? Were they uninsured? Talk about what you saw.
Trauma absolutely discriminates, in gunshot wounds in particular. The individuals who suffered gunshot wounds in our study were similar to people who suffer gunshot wounds every day across the country. They're more likely to be African American. They're young, under 40. They're mostly male, and it's usually they're victims of assaults, and usually uninsured and often in poverty. We used insurance as a proxy for poverty. So that was our population of gunshot wound victims. In the individuals who lived, even with that, the subset of individuals who lived further away, who were injured further away than 5 miles, were even more likely to be African American and uninsured.
When you look at this, you talked about trauma deserts and the neighborhoods where there are no trauma centers, where ironically in Chicago there are so many shootings. You talk about the fact that trauma discriminates in some way, not having a trauma center in the areas where this is going on based on your study. Does this seem like discrimination at all to you?
Well, I don't think that I would say that. I would say that the evolution of trauma centers has been at institutions that have an interest in providing that care. But trauma and health care in this country is subject to market variability. And one of my co-authors on this study has done some work in both emergency room and trauma center closures, and has found that those things are more likely to occur in more distressed neighborhoods where there are for-profit hospitals around, if there are more African Americans, and less of an insurance base. And that would certainly be the case on the southeast side of Chicago, which we borrowed the term trauma desert from the food deserts because there's lack of access to fresh food and some other areas that mark distress in a community. And I think that it more is a reflection of the distress in the community than it was any sort of intent. I'm glad there are trauma centers around the city. I think Chicago has a unique maturity and success of its trauma system. But if you were to, let's say, plan a trauma system somewhere, you would probably want some sort of better access to trauma care in an area of such high vulnerability.
Now, when you talk about centers closing down, much like we saw in that piece with Roseland Hospital, a lot of uninsured patients, people who can't afford to pay their bills. That's a dire situation for a hospital like Roseland with an emergency room, but when you're talking about a trauma center where the care is that much more expensive because you have surgeons around the clock, you have all of the high-tech equipment, do you see a lot of market economics going on as to why certain places are trauma deserts?
That does seem to be the case in the studies that I mentioned of Dr. Shah's work, that areas that are more distressed and have less of a consumer base are more likely to experience both ER and trauma center closures. The question is, what is the effect of that? And we did find that distance, a longer distance, increased transport times were associated with mortality from gunshot wounds. But I don't know that solutions are easy or economically feasible or even necessarily going to predict success.
Yeah, that was my question. I mean, is the solution to this as simple as opening a trauma center on the south side? There's been so much talk about University of Chicago, and they're going out of the trauma business decades ago. There have been protests for them to reopen their adult trauma center. They only serve pediatric trauma patients there. Is it as simple as reopening a trauma center in the epicenter of this trauma desert?
So I think due to the cost and the commitment needed to create a trauma center, I don't know that I could say that that's a simple solution. I think that we've identified a disparity and that it's reasonable to look at whether or not this needs to be addressed and what are potential solutions, i.e. opening a trauma center or potentially helping open a level 2 trauma center that could supplement the level 1 care around the city, or even augmenting the current resources in that area if we thought it was feasible. But a feasibility study would certainly be a first step in informing that discussion. Because remember, this is an observational study of outcomes, not necessarily something that it can inform discussions, but it can't necessarily give the answer to or solutions.
Something to think about for the future for sure. Dr. Marie Crandall, we thank you for your time and for sharing your study with us.
Thank you.
Now, some are asking for mercy. Others want a federal judge to throw the book at Jesse Jackson Jr. and his wife Sandy when they are sentenced in the coming weeks. Here's Chris with more.
A federal judge is considering arguments from prosecutors, defense lawyers, and the public. The former congressman was convicted of misusing campaign funds. Sandy, a former alderman, pleaded guilty to filing false tax returns. We asked some Chicagoans to weigh in on the Jackson sentence.
He knew what he was doing before he was even doing it.
Critics and supporters hold strong opinions on whether Jackson and his wife should go to jail and for how long.
I hope he can just move on. No time served if possible. Financial penalties, to be expected.
With Jackson facing up to 57 months in prison, Sandy up to 2 years, family, friends, and foes have been sending letters to the judge who will sentence them. Texas Congresswoman Eddie Bernice Johnson writes, "I hope you can take into account all the anguish he's experienced committing these acts in harsh light of public scrutiny and national notoriety. I encourage you to judge him by the sum of his life and not only by the mistakes he has made." Another supporter wrote, "He chose to take the high road and admitted his guilt, which we think is commendable." But a former 2nd Congressional District resident took a harder line. Gregory Ritter wrote, Murder would be a lighter crime, as these defendants have used the political hopes and dreams of the constituents as a blank check for deceit. Others, including Sandy Jackson's family members, are pleading for probation, saying she needs to care for the couple's 2 young children. One letter from a relative written in crayon simply said, "I love and need my cousin." For ordinary Chicagoans, the Jackson sentencing evokes sharp responses on all sides.
I'm concerned about, Sandy and Jesse possibly having to do some time, which would be horrible for the kids. But on the flip side, when you do things like that, you take it out of your hands.
I'm fairly shocked that there would be a show of support for someone that used campaign funds in an inappropriate manner to buy himself luxury goods and items and not really serve the people. He's serving himself.
Well, the law is the law. As a legislator, he knew what the ethics requirements were to spend those campaign funds, and if he chose to look the other way, and he gets caught with his hand in the cookie jar, he deserves the consequences.
Jackson's attorney has asked the judge for leniency, citing his history of mental illness. Joining us tonight with their own opinions about the Jacksons and other big stories are Jim Karras, lifestyle expert and author, journalist and author Monroe Anderson, and poet, author, and artistic director of Young Chicago Authors, Kevin Koval. Welcome, everybody.
Thank you.
Jim, you're the judge here. You buy this argument for leniency or not?
Absolutely not. I mean, when you look at what he did, he clearly was a crook. Many of our politicians who have been public that we've seen bad behavior, Bill Clinton, Elliot Spitzer, Stanford in North Carolina, Anthony Weiner, who texted well his last name. These are all kind of, bad behavior, bad boy behaviors. This man stole, and his wife stole. Tax evasion, misappropriation of funds, theft, it's stealing. And you can't say, I'm sorry, I'm a good guy, I made a mistake. He made a lot of mistakes. And therefore, I think he should be punished.
Monroe, we heard the people speak out there. We've seen these letters making cases on both sides. Where do you fall in?
I fall in that he did wrong, but he's done a lot of good. Jesse has a lot of support in the Black Congressional Congress. He has a lot of support, if you recall, even at the time he was under suspicion, shall we say. He was reelected in his district. He's done a lot of good. He's made a lot of mistakes, and he should be punished. But I think there should be some leniency. I mean, he's going to do some time. I can't imagine his not getting some time, but I don't think he should get the full extent of the law.
Well, the sentencing guidelines here for Jesse Jackson Jr. are anywhere from 3 to 5 years, and for his wife Sandy up to about 2 years, although the judge has said she is not bound by those guidelines. Kevin, what do you think would be an appropriate sentence for Jackson and Sandy?
Well, I think the last thing this country needs is, or last thing the city needs is another black person in jail. And I think part of what we should be talking about, honestly, is campaign finance reform. Right. That they have access to $750,000, something that my father might make over the course of 20 or 30 years. Is outrageous. And so,
well, isn't it just as outrageous that he had $750,000 and spent it on things like Rolex watches and rehabbing his home in Washington?
Of course, but this happens every day. I mean, how much money do we spend on defense every day? How much money do we spend on meaningless things? Corporations delve into the pockets of workers every day. I mean, this is just one example, and we're holding him up, and he's
pleaded guilty to this.
Yeah, which is fine. But I mean, him going to jail is not going to change the gross inequity that exists between people who have a ton of money and people who don't.
But is that the point?
Yeah, well, see, the point Kevin is making is a good one in that most people, particularly in Jackson's congressional district, don't understand necessarily or don't subscribe to taking money out of your campaign funds as being a major crime. I mean, it's just, you got murders going on, and you have robberies, you have severe poverty. So the idea that people contributed to a campaign and he misused the funds on a scale of 1 to 10 is closer to a 2 than a 10.
But Jim, should he go to jail for that?
I really have to say I disagree. I feel the fact that he came from privilege, the last name, the junior, the opportunities that he had to make such a rookie mistake and such a repeated, again, I have to say repeated mistake. He did not do it once. He did it multiple times. I think it makes it infinitely more punishable, and he should be held up that if you behave in such a way, these are the ramifications. And I know that we know jail is not always a deterrent. You know, for many crimes, the research on that is huge. But I think the statement has to be made that this will not be tolerated. And hopefully, as you said, Kevin, let's look into it more. Let's delve deeper into it.
While we're talking about courts, we have to move on here to the Chicago Teachers Union, filing federal lawsuits against the school district, civil rights, because of the school closings scheduled. Do you think it is a matter of civil rights, Kevin?
Easy. I work in schools every day, and the schools that they're targeting, the schools that they're closing, the schools that don't have enough in this city are by and large black and brown. And so it's an issue of civil rights. If we cared as much about the education of white children as we do about black and brown children in the city, those schools would look very different. The funding that they get, the resources they have access to would be radically different. If Rahm Emanuel's kids went to Delano Elementary School, I guarantee Delano would not be on that list.
Yeah,
and the resources
he wouldn't do that.
Yeah, well, of course he wouldn't do it.
He wouldn't send his kids to North Side.
And that's part of the point, though.
Exactly.
Until all of the schools are good enough for the mayor's kids or any of our kids, then the schools aren't good enough. And
doesn't this build on exactly what we saw the segment right before us on the emergency care centers? Yep. This is about economics. And again, it's going back to where the money is and where things can make sense economically. Because let's face it, as a country, we're a disaster economically, and in Chicago, we're a disaster economically. So I don't like to see these school closings any more than anyone else here does. But what's the other solution? Well, I don't happen to know that.
Yeah, but closing the schools, you have empty buildings now in a community where people are dealing drugs and what have you. So now they have headquarters they can set up, drug headquarters to set up. I mean, it's and how do you get rid of 50-some empty buildings? What do you do with them?
And what do you do with those kids? I mean, you're sending them across lines.
Yeah, across gang lines. It's not that's not the solution.
Do you think this is going to be a long-term problem for Mayor Emanuel? The Tribune did a recent survey showing nearly 60% of Chicagoans don't approve of the way he's handling education, and obviously the school closings and the teacher strike is tied into that. Is this a problem politically for Mayor Emanuel?
When he was elected, or my position was because Mayor Daley had made such a fine mess of the city in the 20-some years that he was in office, that whoever was elected was probably going to be a one-term person because you can't straighten it out. I mean, you know, Daley has sold off the goose that lay the golden egg, so you don't have the revenue stream.
Rahm's also in that center of the architecture of privatization of public education.
Oh, yeah, no, he's a corporationalist.
So, I mean, he, Obama, Arnie Duncan before him, they believe that education can be sold to corporations as opposed to it being a right based on your being in this city.
And while we're talking about public money, we now know that Mayor Emanuel has big plans for McCormick Place and for Navy Pier, including a new basketball arena for DePaul University. And the big question is going to be, should public money, and as I understand it, about a third of the $300 million, at least for McCormick Place, is going to come from DePaul, the rest from public funds. Does public money, Jim, belong in financing a basketball arena for DePaul?
Let's ask a business question. Do we make a third of the profits? If we put up a third of the money, are we then a third shareholders in this entity? Or are we just putting up the money just for fun? That's what I take really a big issue with. I think that it should be handled like any other business. And we were chatting, actually the three of us beforehand, why for sports? Why for a sports arena? We have the United Center, we have the Allstate Arena, we've got a lot of that. What other ways did anyone at a macro level look at, let's do something for Chicago, let's bring tourism here, let's help hotels, let's help restaurants. Why did they go to the sports? Why did they not go to the arts or something else?
In fairness here is to bring more restaurants to Navy Pier as well as 2 hotels.
Yeah,
but are we supposed to redo Navy Pier as well? Isn't that also on the docket?
Yes, it is.
And Chris, that won't help. If they were serious about that, they would have brought some sort of entertainment complex there, where you could have the arts.
How about a casino?
Yeah.
Oh, I'm all for that.
Yeah, right. Exactly.
But who is the city for? I think that's a larger question. We're trying to build and spend for people who are not here, yet the infrastructures of our citizens are falling apart. The schools, literally, there's no trauma centers on the south side. There's no grocery stores on the south side. You can't get fresh produce if you live in certain zip codes. And so I think it's really a matter of not only economics, but asking ourselves, who is this city for, and who is the new city that the mayor and all of the businesses are trying to build? It's not for folks who currently live here. They're pushing them out.
Yeah, no, and I'm sure they're thinking if you put the stadium there, then it will bring in new business, which will help the south side, the near south side. But again, I think that a better venue than a sports venue, a cultural venue, would work better. In Chicago, culture, the arts, brings in $2.2 billion a year. Because when people come to an arts event, they not only go to whatever it is, the venue it is, but they eat out at a restaurant. Mm-hmm. Frequently they come, because it's the arts, they come from someplace else, not from the suburbs, but they may come from some other country.
And Roy, I have to stop you there, but while we're talking about big money, we just have 1 minute left. Donald Trump's in town, taking the stand in this fight with an 87-year-old woman who invested in condos, and now, talking about chutzpah, he says that she's playing the age card.
He's the Donald. He did this. Let's remember, everyone. He gave a discount to every decorator, engineer, designer, anyone, architect involved with it. He reneged on that deal with all of them. He's just notorious on reneging on deals. If you're going to get into bed with Donald, just know you're going to get into bed with someone who's going to change their story. Don't be surprised.
You'll get fleas.
Quick thought?
First of all, I don't really care about rich people problems. Second of all, no one has called this dude Donald Trump. It's 2013. He doesn't go by that name, Donald Trump. I'm about Trump. Okay. Yeah.
Okay. On that note, we have to wrap it up. Thank you very much, Jim Karras, Monroe Anderson, and Kevin Koval. We drive over it, we boat on it, we turn it green every St. Patrick's Day. The Chicago River is an important part of our city's landscape, but what's happening deep down below, beneath the murk? WBEZ gets to the bottom of it in this week's Curious City.
So I was wondering, what is at the bottom of the Chicago River?
To find out more about Curious City, go to our website, WYCC.org, where you'll be able to cast your vote for the next Curious City story. Then stay tuned to In the Loop to see which story wins the most votes. That's all for this week. You are now in the loop.
The conversation continues right now on WYCC.org. I'm Barbara Pinto.
And I'm Chris Bury. Until next time, good night.